I would like to now invite Dr. Brian Malaco to give us our main talk. Thank you very much.
Okay, a lot of what I'm going to say today is going to be controversial. I'm going to take us through a journey through insulin-resistant, metabolic syndrome, obesity, and diabetes spectrum, because they are a spectrum, they're one and the same thing, and try and demonstrate that many chronic conditions in ENT and in all other specialties have as a root cause insulin resistance. So this is a Coney Island beach in 1934. And if you zoom in there, you'll find it difficult to find one obese person. And now this is Coney Island beach recently, and 2/3 of the people are going to be obese. And photographs like this are not uncommon on our beaches. So if you have a look at obesity, it has skyrocketed from 1975 and is projected to be 45% in the USA in 2025. Global obesity has also gone up a lot. In China, obesity has gone up to 6% from 1%, although in the affluent areas, it's 20%, and it will probably soon match the rest of the world. And it's not only adults. Children are getting more and more obese. We're seeing type 2 diabetes in children, which we never used to see. So diabetes has become a real problem. If you have a look at China, in 1978, there was 1% diabetics. It's gone all the way up in 1993 to 2.5, 5.5. It's now sitting at around 13% in China. And that makes 116 million people in China are diabetic, and a whole lot more are pre-diabetic. India's got 77 million, USA 31 million, and South Africa about 6 million. So why don't we want to have diabetes? Well, it's the commonest cause of cardiovascular disease, amputations, renal failure, and blindness. So you really don't want to have diabetes, and if we can do anything about it, we must. And it's also been shown that injecting copious amounts of insulin does not improve outcomes. So let's have a look at the cause of obesity. This is Susan Mendoza. She was on America's Biggest Losers, which is a TV program that goes over 9 months. And the people move more and eat less, go on a low-fat, low-calorie diet, lose a fortune of weight, and win a prize. But Susan says there's never a reunion show because they're all fat again. Why are they all fat again? Well, if you look at the literature, 99.9% of diets fail over 2 years. They all work over 6 months, but greater than 2 years, they fail. 1 in 240 men and 1 in 124 women succeed long-term on a low-calorie diet. So, and that's what we prescribe, and that's what our dietitians prescribe. Let's have a look and see why this happens. If you have a look, this is an endocrinology journal article where they studied these American Biggest Losers, and this is before and after. So the basal, the resting metabolic rate of this guy was 3,600 calories before the show started. It went down to 1,800 calories. So he just has to start eating more than 1,800 calories, he puts on weight again. And if you have a look here, this is how much free fat mass he lost. So he lost nearly 25 kilograms of muscle and connective tissue. So what they've shown is if you go on up to a 4-day fast, your basal metabolic rate actually goes up. It's just this low calorie thing that pushes your every day, the same stuff that pushes your resting metabolic rate down. So let's look at the proximate cause of obesity versus the ultimate cause. So the proximate cause is calories in, calories out. But if you have a look at this aeroplane, the proximate cause of its crashing was that the force on the wing was greater in a downward direction than an upward direction. It tells us absolutely nothing. The ultimate cause would be pilot error, running out of fuel, and so on. So what is the ultimate cause of obesity? Well, the ultimate cause of obesity is high insulin and insulin resistance. So what causes insulin resistance? Well, prolonged high levels of insulin. And the more insulin you're producing, the more insulin resistant you get. And the more insulin resistant you are, the more insulin you are going to produce. So it's a vicious cycle. Unfortunately, your degree of insulin resistance is largely genetically determined. This is a bell curve of a population and how many carbohydrates they can have every day before they become insulin resistant. And you can see by 160 grams a day, 2/3 of the population are becoming insulin resistant. And yet the SAD diet, the standard American diet, which we all eat, recommends that we eat 250 to 350 grams of carbohydrates per day. So you are going to get your high-enders here that can do that, but most people can't. 2/3 of America are either obese or overweight, so they cannot tolerate this recommended diet by the US Department of Agriculture. The very people who sell the wheat and so on are the ones who determine our diet. So insulin is a storage hormone. It stores fat. So while your insulin is high, you cannot burn fat, and it drives drives glucose into the cells. So if you have a look, if you eat 3 meals a day, you will be fasting for 12 hours while you're sleeping, and a little bit in between. If you eat 2 meals a day at 16/8, the fasting period is longer. And you can see when your insulin up, you're fat storing. When your insulin is down, you're fat burning. So really, we need to spend a lot more time burning fat than storing it. If you have a look at how often people eat, these are children, these are adults. The green is 1977, and this is how many meals people had a day. Most people would eat 3 meals a day. And slowly you can see over the years, the curve has moved over to the right side, and we're eating far more often. The average American puts calories into his mouth 8 times a day, and really gives the insulin no time to go down. If you have a look at ghrelin, the hunger hormone, if you eat a lot of carbohydrates here in red, the ghrelin will come up again 3 hours later. So you have your wheat Bix and toast, and at 7 o'clock in the morning, by 11 o'clock, you're hungry again. If you have a protein and a fat meal, 6 to 8 hours before ghrelin comes up again. We also know that carbohydrates goes to the reward center in the brain, the same center that cocaine goes to, and protein and fat goes to the satiety center. So if you eat a lot of carbohydrates, you're going to just eat more and more. Just to remind you how many, we remember that 160 gram level, how quickly you can get to that. Well, a banana has 6 teaspoons of sugar in. All brand has 10, Coke has 9.5. You get the idea. There are lots of carbohydrates in all these processed foods. And you're going to get to that figure where you become insulin resistant very quickly. So the causes of obesity, the ultimate cause is high levels of insulin. How do we know that? I can make anybody fat. Just inject them with insulin or give them diabetic drugs that raise insulin. You put on weight. Patients with insulinomas get very fat, and as soon as you take them out, they lose the weight. We know in type 1 diabetes, where there is no insulin, people cannot retain fat. And every little teenage girl type 1 knows if she wants to lose weight, she just under-injects insulin. And the actors know it too. This is Matthew McConaughey, who gained 47 pounds for a movie role. And he did this by injecting insulin and eating a high carbohydrate diet. So if the first cause of obesity is high levels of insulin, the second cause is high levels of cortisol. It raises the blood sugar. We know in transplant patients that put on weight, Cushing's syndrome, where there's lots of cortisone, they get fat. Addison's, where there's no cortisone, they get wasted. And we know that mental stress, which pushes up cortisol levels, is a potent cause of obesity. So insulin resistance is time dependent. The average diabetic has a raised insulin for 14 years before he develops diabetes. And we hardly ever measure insulin, and we should be doing it. What about fructose? Fructose is from fruit. It's sweeter than glucose. It does not raise blood insulin. It does not contribute to HbA1c. Must be good. Actually not. It's the Lex Luthor of carbohydrates. It's 7 times more potent than glucose in causing a fatty liver and insulin resistance. And I'll just go through the mechanism quickly in a minute. And it's because of its 5-chain ring, it forms AGEs, advanced glycation end products, much easier than does glucose, and therefore may contribute to Alzheimer's and other glycation diseases. So how is fructose metabolized? It's metabolized exactly like alcohol. It comes into the metabolism, it goes down, tries to get in the Krebs cycle. The Krebs cycle is already full, so what happens? It goes up the DNL, a de novo lipogenesis path, and forms fat. And then you pump out loads of triglycerides. Your triglycerides go up. Eventually, it can't cope, and you get a fatty liver. So the two things that give you the most potent fatty livers is alcohol and fructose. Okay, I'm not talking about the 10 grams you get in an apple. The average teenager in America eats about 60 grams of fructose a day. And in 1920, we ate less than 20 grams. So really, the poison is in the dose. Have a look at the sugar consumption from 1700 to now. The average American eats 50 pounds of sugar a year, and I'm including everything that turns to lactose, glucose, and fructose. And you can see that the obesity epidemic has gone up just as quickly. How do we treat diabetes? Well, just like these Japanese train pushers, all we're worried about is getting the insulin out of the blood and into the cell. So so type 2 diabetic has already got a high insulin. What do? We inject more insulin and force them into the cell and just hope that that's going to give them good health. Well, I can tell you that it doesn't. This UK general practice of 84,000 newly diagnosed diabetes between 2000 and 2010 were divided into 2 groups. The one group were controlled to an A1C of 6 and the other group to 10. There was no difference in heart disease. The tightly controlled group all-cause death rate was double. You can only assume it is due to the excess insulin. They also gained 8.7 kilograms as opposed to the A1C equals 10 group. The second study looked at the death risk in type 1 diabetes and found that it was not related to HbA1c. It was related to the factors of metabolic syndrome. So let's just summarize the hormonal theory of obesity. You eat fattening carbohydrates, insulin goes high, you get insulin resistant. Fructose is far worse than glucose. And we believe that the diabetic epidemic in China is due to fructose, because they used to eat 70% carbohydrates in the form of rice, and they were not fat and they didn't get diabetes. But as soon as they had processed food with sucrose and high fructose corn syrup, they started getting an epidemic of diabetes, fatty liver, and the whole spectrum. So let's just quickly go through metabolic syndrome. It's abdominal obesity, which really just reflects how much fat is there in the liver and the pancreas. Of all the measurements, the best one is measure around the belly button, and that must be 0.5 or less than your height. If it's above that, then you have got probably got a fatty liver. Obviously, ultrasounds and so on of the liver are more accurate. Low HDL, high triglycerides, and we know that's associated with a high carbohydrate diet. High blood pressure, and we call it essential, but we actually know that the mechanism is insulin. I'll explain that in a minute. And then your fasting blood glucose is greater than 5.6. That's the metabolic syndrome. It's associated with cardiovascular disease, fatty liver, all sorts of diseases. So the diet heart hypothesis says the LDL gets high and it somehow gets into the under the endothelium and it causes atherosclerosis. It's not very convincing. I think the more plausible thing is that something damages the endothelium. The LDL goes along there to try and repair it, And we know glucose damages the endothelium. We know smoking damages the endothelium. And now we're pretty sure as well that insulin damages endothelium. It has growth hormone properties, it's highly inflammatory, it attracts all kinds of cytokines. So we think that high insulin is in itself toxic. So it's got a huge role in the endothelial damage to macro and micro of the vessels. It's probably the cause of hypertension in most people. How does it work? It inhibits the action of nitrous oxide, so your blood vessels don't dilate. And it also hypertrophies the muscle in the arterioles. It also has a direct effect on angiotensin in the kidney, and you get sodium and water retention. What we do know is that people who go on a low carbohydrate diet to reverse their diabetes, almost 100% of them get rid of their hypertension. And yet we call all those hypertensions essential, pretty much an insulin-resistant condition. We also know that it has an effect on the APO in the brain, and it causes Alzheimer's, and we don't know the exact mechanism, but it's something to do with insulin and glucose. I just want to run through all the chronic conditions that this insulin toxicity causes, and a lot of these things have been reversed on low carb and intermittent fasting. In the brain, it's Alzheimer's, Parkinson's, migraine. Migraine can be reversed by going on a low carb diet. There are many skin conditions. We know about the skin tags in diabetes. Psoriasis can be reversed. Fibromyalgia, osteoarthritis, gallstones are increased. Apologies for going so quickly, but it's quite a long talk and I want to get through it quickly. PCOS, we know we give metformin for PCOS. It would be much more effective to put them onto a low-carb diet. And in fact, people are reversing infertility of PCOS by low-carb diets. Retinopathy, we also know in diabetic retinopathy that the retinopathy occurs way before the sugar goes up. So we think it's an insulin toxicity. So the sugar cancers are well known: prostate, breast, colon, pancreas, associated with high sugar diets. Even COVID-19, who does badly? Diabetes, obesity, hypertension, people of color. They're all insulin resistant. That's what they've got in common. And every cell in the body has ACE2 inhibitors, ACE2 receptors, and insulin acts on that to retain fluid. So insulin causes water retention by attaching to the ACE2 receptor. And because of that, it upregulates the ACE2 receptors, and COVID takes advantage of it. And that more or less explains why those people do so badly. Now let's just get to ENT. Now, I started 10 years ago getting very, very disillusioned with giving nasal sprays and cortisone and acid reflux medicine, and it kind of helps. And I thought, well, what is causing this? And it turns out that high insulin levels are very inflammatory. They cause inflammation in all the mucous membranes, and therefore they cause sinusitis, ear infections. And I started treating my patients with low carb and intermittent fasting and had amazing results. And if you look at the literature, yes, acid reflux is part of the problem, and that is also obviously part of the abdominal obesity and so on. But it's not the whole story. The insulin itself is toxic, and you need to get it down. Tinnitus, the one study I looked at, 90% had insulin resistance. Hearing loss, manias, sleep apnea, all associated with manias, and should all be treated metabolically with diet and lifestyle. So what is the solution? Well, the solution is, first you need to diagnose it. How do we diagnose it? We do a fasting glucose and an HbA1c, and that's probably where most doctors stop. But really, you need to do a fasting insulin, you need to do the HOMA index, and you need to do the C-peptide. C-peptide indicates how much insulin your pancreas is producing, which differentiates it from injected insulin. The other things we can do are, we can look at the triglyceride HDL ratio. You want your triglycerides down, your HDL up, and that is a strong indicator of metabolic syndrome. Your fasting glucagon, very sophisticated. Otherwise, we can do an ultrasound of the liver. We can look at CRP and other inflammatory markers. I've got here mentioned TOFIs. What a TOFI is means thin on the outside and fat on the inside. So many people, luckily, are genetically don't put on weight. But if you go and do all these investigations, they are terrible. And they have just as many complications as an obese patient with the same reading. So what do we aim for? We want an A1C of less than 5 is amazing. 5 to 5.6 is fine. And above that is pre-diabetes. Triglycerides, we generally want it to be 1 or below. The HDL, we want it to be up to 1.5. If you can get a HDL triglyceride ratio of 1, you're doing well, and you probably don't have metabolic syndrome and you don't have insulin resistance. What is the solution? A metabolic disease needs a metabolic solution. Get the insulin down as low as possible for as long as possible. And how do we do that? Well, one of the ways of doing it is a low carbohydrate, healthy fat diet, and intermittent fasting or time-restricted eating. And the diet and the fasting will be different. If you're a healthy person, which has got none of these problems, you've got to probably eat 80 to 100 grams of carbs a day. But if you're trying to reverse diabetes, you've got to go onto a diet that is less than 20 grams of carbohydrate a day. We know in bariatric surgery that very soon after bariatric surgery, diabetes reverses, long before there's any significant weight loss. And we're pretty sure that what happens is you lose fat in the pancreas, you drop your insulin, the fat in the pancreas is very toxic, you start producing insulin again, and you start reversing the diabetes. Can we mimic this? Yes, we can. Low carb, high fat, and intermittent fasting. I'm going to just give you some anecdotes, and then we'll go on to the literature. These 3 patients of Professor Tim Noakes did that, and they reversed their diabetes. This guy went down and lost almost half his body weight, hypertension gone, diabetes gone. This guy did almost the same thing. And the chap on the end, he reversed his atrial fibrillation, his hypertension, his sleep apnea, his dry, flaky skin, and his gout. Okay, all by reversing insulin resistance. Dr. Jason Fung is a renal specialist in Toronto who's at the forefront of diabetics reversal, and this is one of his patients. In just over a year, she reversed her diabetes and lost that kind of weight. Dr. Unwin is a GP in England, and he's in a 9-man practice, and he's published a lot on diabetes reversal. This is one of his anecdotal cases where he brought the HbA1c down from 10.8 to 5.4, and this guy's off all his insulin and his oral hypoglycemics. And let's look at the evidence-based medicine. In San Francisco, they're doing a trial, and they reversed 63% of 262 diabetics at 1 year. And the ones, if you read the paper, and I've got all these in PDF if anybody wants them, you'll see that their hypertension went away and there were many other benefits. This is a small random controlled trial, one of the first, and hopefully we're going to get a whole lot more, where 17 out of 36, 47% of diabetics were put into remission in 12 months. Remission was defined as an HbA1c of less than 6.5 and off all drugs. And in the control group, only 1 out of 36, 2.8% reversed their diabetes. This paper from Dr. Unwin, who I told you about, he's looked at his diabetics since 2015. They've noticed an 8-fold increase in diabetes in 3 decades. They've got 117 diabetics in remission in their practice. And the one trial they did for 2 years, they reversed 46% of 128 patients. Remember, reversal is HbA1c of 6 or below and off all diabetic drugs. 93% of 71 patients who had pre-diabetes and elected to do their protocol reversed their pre-diabetes. Okay, and then the same Verta Health study. Am I gone?
No, you're there.
Okay. All right. The lights have just gone out. The same VertaHealth study. 79% of 262 patients reversed their yeah, I didn't have lights for a minute, couldn't find the button. Okay, reversed their non-alcoholic fatty liver disease. In paper 2, 173 patients had osteoarthritis, and they were assessed on a thing called the QUIS score, which is a score on knee pain and inflammation and so on, and all of them improved after this. Okay, so Albert Einstein said, blind belief in authority is the greatest enemy of truth. And I'm afraid us doctors, we just listen to the guidelines, we listen to our professors, we never think laterally. And I think it's time we started looking to treat the real cause of diseases, not just looking through the MIMS and finding drugs. So this has been a passion of mine for a long time now. And I really have had good results in those patients that I've been able to persuade to do this. I haven't had time to go through how you do the low carb diet. It'll make the talk too long, but I'm open to any questions. Thank you.
Thank you very much, Brian. A very interesting talk. Any comments or any questions? We've got a lot of important people in the audience. Any questions or any comments? Brian Biddulph, you are in the area. Please tell us your thoughts.
I think they're all stunned because it's so controversial.
You come forward. They've got no further questions. They are, yeah.
Okay, great. Fine.
Yeah. Was that finished?
Excellent talk and most excellent talk. Thank you very much.
Yeah.
Thank you.
Thank you.
Thanks very much. If you have no questions.
Thank you, Brian. Thank you very much indeed.
Thank you, Brian. Really a nice talk.
Brian, I don't know if you can hear me.
Before you go.
Yeah, I can hear you, Brian Biddulph.